So the number one risk factor for getting breast cancer, unfortunately, is just being a female. However, we know there are other things that contribute to breast cancer formation and breast cancer recurrence. And so obesity, you're going to have more of those hormones around that can feed tumor cells. Taking combined hormone replacement therapy over time can increase the risk of breast cancer. Smoking is associated with breast cancer as well as more heavy alcohol use can be associated with higher incidence of breast cancer. As far as your family history, that's important. Another myth, rather, is that that all breast cancers must be caused by some genetic mutation in the family, and only about 6 to 8% of all breast cancers are actually caused by the gene. So screening currently is at age 40. So women are given the option to start at age 40 for yearly mammograms. And then women who have a life expectancy greater than 10 years should continue annual screening. Breast pain does not equal breast cancer. It's usually a painless mass that feels somewhat irregular. You don't have to have any symptoms of feeling overall not feeling well. Like, you may feel perfectly normal and have a breast lump. Is this lump changing? Is it firm? Those are concerning symptoms. You don't always have to have an overlying skin rash or skin changes or nipple discharge. Those things can happen with breast cancer, but typically are a little later. So paying attention to your breast, if you do feel a mass that is new, you haven't felt before, I would have that checked out. What we love about the screening mammogram is that it catches a lot of cancers that even I can't feel, that I know is there, the patient can't feel, but it's so small, it's picked up easily on the mammogram and can be treated so much easier at an earlier stage. So there are various kinds of breast cancers. There can be invasive ductal, invasive lobular, which just means where it started in the breast. However, we do what we call special stains on every breast cancer to see what's feeding that cancer: estrogen, progesterone, or a growth protein called HER2. If it's positive for any of those receptors, that actually dictates the kind of treatment the patient's going to receive. Anti-hormonal treatment, sometimes chemotherapy, etc. So we use information from that biopsy to determine what kind of cancer is this and how will it respond to the various treatments that are available.